Greetings once again from Expanding Choices here in Albuquerque, New Mexico. And today I'd like to further talk to you about our Prevent and Event screening. And we have a special going on for September 6, 13, and 20 where you get 20% off. Some of you may be asking, why is this important to me? You may be younger, feel you're at an age where a heart attack or stroke is not possible, but we see younger and younger people, particularly women, having heart attacks and stroke, maybe in their 30s or 40s, and suffering the consequences of this for the rest of their life. Now, we know 80 to 90% of heart attacks are preventable and 50% of strokes. The reason they're preventable is because we can do something about the inflammation that is present in our bodies. But we only know about that if we get screened for this. Now, I had a friend recently said, hey, I just brought my car in for this special. They're doing checks on everything, all the computers, the points, plugs, condensers, oils, whatever. It's $199. I said, is something wrong with your car? He said, no, it's running well. Take it to work every day. We go on trips, maybe head up to Santa Fe or Taos. So I said, so your car's running fine. You have no problems with it, does everything you want to do. You're going to take it in today, inconvenience yourself, and spend $199. Why would you do that? And he said, well, I don't want something bad to happen to my car. I don't want to be on the way to Santa Fe or Taos and be on the roadside and have to call road assistance. I said, I see. So you are being active. You're trying to prevent an event with your car. So I said, are you doing the same thing with your health, your sort of human car, your body? Because I know your car can easily be replaced, but your body not so. He said, well, I'm doing fine. I'm young enough. I don't think there's any problem. And with that, I told him the sort of bitter statistics on this. And most people, over half of people who die from a heart attack, have no symptoms and they have no history of this. So they're doing perfectly fine. They're just like his car, running fine, trips up north, going to work every day, going to the store to shop, no problem. But he's taking his car in. These people who are dying from a heart attack have no problem also. But if they can do a prevent and event screening, they can know if they're inflamed, if they're maybe pre-diabetic or diabetic, which is extremely common, even in people who wouldn't think that. People often have this opinion, I'm not obese, I'm not massively overweight, so I can't be diabetic. That is not so. We see many people who are what's called skinny fat, and they have a lot of insulin resistance and pre-diabetes or diabetes. This certainly is a big risk factor for heart attacks and stroke. You can know this in yourself, and we utilize some of the best technology available, the HeartSmart IMT Plus, to do an ultrasound of the carotid artery in your neck. Now, a recent study was just published in the American Journal of Cardiology, April of 2016. And this was out of University of California at Irvine, where they also utilized the same HeartSmart IMT Plus technology, which we at Expanding Choices have been using for the last 7 years. And in this study of over 20,000 men and women, they found that many of these individuals who actually had excellent thickness of their arterial wall, in other words, it was thin, and that would be indicative of very low risk. But many of these people also had soft plaque. And soft plaque is extremely risky, particularly in the presence of inflammation. So the HeartSmart IMT Plus will look at the thickness of the big artery in your neck. And this is an important factor as far as your cardiac risk. But even in people who have a thin artery, and we know thin is in. And so in arterial health, if the artery wall is thin, that is good. But even in those people, many had plaque, and particularly very risky soft plaque that can rupture and cause a heart attack or stroke. So this technology will pick up if you have plaque in your neck, and what type of plaque. Is it hard plaque, which is a little less risky, or soft plaque, which is extremely risky? And we know if you have this plaque in your neck, there's a 70% likelihood or greater that you have this same plaque in your carotid arteries. So on September 6th, September 13, and September 20, Expanding Choices is offering to you a 20% discount on our Prevent and Event screening, where you will receive the HeartSmart IMT Plus examination to look for thickness of your arterial wall as well as plaque. We also do a very comprehensive blood chemistry evaluation so we can know if you have inflammation present in your body. We can know if you are headed towards diabetes. We can look at your liver function and kidney function. And we also offer, with this Prevent and Event screening, a 45-minute office visit with myself, one-on-one, where we can go over all these results. I can provide my recommendations to you on how you can prevent an event. So I would urge you to call our clinic today. The phone number is 505-508-1745. And I urge you to take care of your body as well, or actually better than you would take care of your new car. Provide it with preventive maintenance so you can prevent an event. Thank you for joining me today. I look forward to spending time with you on future videos.